When most people think about managing diabetes, they immediately focus on cutting carbs, taking medications, and checking blood sugar. And yes, those things matter. But there's another side to diabetes that often gets overlooked, and that side is nutrition at the cellular level. We're not just talking about macronutrients here, we're talking about micronutrients, vitamins and minerals that help your body function properly. The right nutrients can improve insulin function, reduce inflammation, support nerve health, and even protect your heart and kidneys. And yet many diabetics are unknowingly deficient in some of the most critical vitamins their bodies need to heal. That's why in this video, we're going to break down the top 3 vitamins every diabetic needs to pay attention to. These are vitamins that are often low in people with type 2 diabetes, and getting enough of them can be a game changer. Let's start with vitamin D. Most people associate vitamin D with bone health or immunity. But if you have diabetes, vitamin D plays a far more important role than you might think. Vitamin D helps regulate insulin sensitivity. It reduces chronic inflammation. It supports nerve function, and it helps protect your organs from long-term complications. Here's the problem. People with diabetes are more likely to be deficient in vitamin D. Why? Because high blood sugar and insulin resistance interfere with how the body uses vitamin D. Frequent urination in diabetics also causes more vitamin D to be lost through the kidneys. And since many people with diabetes avoid outdoor activity, their sun exposure, the main way your body produces vitamin D, is limited. As we age, the body becomes even less efficient at processing vitamin D. The pancreas and liver, 2 organs that play key roles in vitamin D activation, become less active. That means even if you get some sun or take a small dose of vitamin D, your body may not be absorbing or converting it effectively. So how do you know if you're low in vitamin D? The signs can be subtle but serious. Fatigue, joint pain, bone aches, frequent infections, mood swings, sugar cravings, and even numbness or tingling. All of these can be linked to vitamin D deficiency. It's also been connected to diabetic complications like diabetic neuropathy, diabetic retinopathy, kidney dysfunction, high blood pressure, cardiovascular disease. That's because vitamin D is involved in insulin production, inflammation control, nerve signaling, and blood vessel protection. Studies show that low vitamin D levels are correlated with higher A1C levels, more insulin resistance, and greater risk of diabetes complications. So what can you do? First, get tested. A blood test measuring 25-hydroxy-vitamin D is the best way to assess your levels. The optimal range is usually between 40 and 60 nanograms per milliliter, though this may vary slightly depending on your healthcare provider. Then focus on getting more vitamin D through food and sun exposure. Cod liver oil is the richest natural food source, offering over 300% of your daily value in just 1 tablespoon. Wild-caught salmon, sardines with bones, egg yolks, and mushrooms grown under UV light are also good sources. If you're struggling to get enough from diet and lifestyle, supplements can help, but be sure to choose the right type. Vitamin D3 is more bioavailable than D2, and many people benefit from taking it alongside vitamin K2, which helps direct calcium to the bones instead of arteries. Look for reputable brands like Nordic Naturals or Thorne Research. Common dosages range from 1,000 to 5,000 IU per day, depending on your needs and your current blood levels. And while you're working to increase your vitamin D, avoid things that deplete it, like excess alcohol, processed vegetable oils, refined sugars, and antacids. All of these either block absorption or increase inflammation that makes vitamin D harder to use. Getting enough vitamin D isn't just about stronger bones. It's about reducing inflammation, improving blood sugar control, and protecting every major system in your body. Coming up next, we'll look at the second most important vitamin for diabetics, one that most people are losing without even realizing it. Now let's talk about another critical nutrient, one that most people with diabetes are losing without even realizing it. Vitamin B12. Vitamin B12 plays a central role in the body's energy production, nerve function, brain health, and red blood cell formation. But here's the scary part. Many people with type 2 diabetes are unknowingly deficient in this vitamin, and their medications may be partly to blame. The number one culprit? Metformin, one of the most widely prescribed drugs for type 2 diabetes. While it helps lower blood sugar, metformin also interferes with the body's ability to absorb vitamin B12 from food. Over time, this creates a deficiency that gets worse the longer the medication is used. And since diabetes itself causes damage to the stomach lining and reduces acid production, it becomes even harder for the body to extract B12 from meals. The result? Your body slowly runs low on B12, and the symptoms creep in so gradually that most people don't even realize it. What are the signs of low vitamin B12? Numbness or tingling in hands and feet. Fatigue that doesn't go away with rest. Brain fog, poor memory, or difficulty concentrating. Shortness of breath or dizziness. Mood changes and even symptoms of depression. Some of these symptoms are easily mistaken for just getting older or normal diabetes complications. But in many cases, they're actually signs of a correctable vitamin deficiency. Vitamin B12 is essential for nerve repair. Without enough of it, the myelin sheath, the protective layer around nerves, starts to deteriorate. That's why nerve pain and diabetic neuropathy often worsen with B12 deficiency. It also plays a key role in homocysteine regulation. High levels of homocysteine can damage blood vessels, increase inflammation, and contribute to kidney and heart disease. B12 helps convert homocysteine into methionine, a harmless amino acid. Low B12 affects fertility too. In men, it reduces sperm quality and testosterone production. In women, it interferes with ovulation and hormone balance. Vision can suffer as well, since the optic nerve depends on B12. Severe deficiency can even lead to permanent vision loss. And at the cellular level, B12 is like motor oil. It keeps everything running smoothly, from DNA synthesis to the energy cycle in your mitochondria. So how can you fix this? Start by adding B12-rich foods to your meals. Beef liver, 100 grams, over 3,500% of daily needs. Clams, 100 grams, over 4,000% sardines, salmon, tuna, between 200% and 400%. 2 large eggs, around 25%. If you prefer gourmet options, foie gras, sea urchin, and lobster are incredibly rich in B12. But for many people, especially those taking metformin, food isn't enough. That's where supplementation comes in. The best forms are methylcobalamin or hydroxycobalamin, which are more bioavailable and better absorbed than synthetic cyanocobalamin. Top supplement brands include Jarrow Formulas, Methyl B12, 5,000 micrograms per lozenge, Thorne Research, Methylcobalamin, 1,000 micrograms per capsule. Lozenges or sublingual forms are ideal because they bypass the stomach and absorb directly into the bloodstream. And just like with vitamin D, there are things that can make a B12 deficiency worse. Excess alcohol, acid-reducing medications like omeprazole, processed grains, and refined sugars. If you've been feeling tired, foggy, or dealing with nerve pain, it might not just be diabetes. It might be B12. Correcting a B12 deficiency is one of the simplest and most powerful ways to support your energy, nerve health, and long-term wellness. Let's talk about a vitamin that rarely gets attention in diabetes conversations: folate, also known as vitamin B9. Most people don't realize how essential this nutrient is, especially if you're living with diabetes. Folate isn't stored in large amounts by the body, which means you need to get it regularly through food. And here's the issue. Diabetes makes it harder to absorb, use, and hold on to this crucial vitamin. That's because chronic high blood sugar causes inflammation and oxidative stress, two things that interfere with how your body metabolizes folate. Add to that the fact that metformin, one of the most common medications for diabetes, also blocks folate absorption in the intestines. So even if you're eating well, your levels may still be low. And since folate is water-soluble, diabetics often lose more of it through frequent urination. But here's the tricky part. Folate deficiency looks a lot like common diabetes symptoms. You might feel fatigued, even after resting, mentally foggy or forgetful, slower to heal from cuts and bruises, moody or emotionally off, weak or short of breath. Sound familiar? That's because folate is required for red blood cell production, DNA repair, and neurotransmitter balance. When you don't have enough, everything from your immune system to your brain slows down. In more advanced cases, folate deficiency can lead to anemia, a condition where your body doesn't produce enough healthy red blood cells. You might look pale, feel dizzy, or struggle to catch your breath. And in people with diabetes, this can worsen fatigue, insulin resistance, and overall healing. Folate is also vital for fertility and hormone health. In men, low folate damages sperm quality and mobility. In women, it interferes with ovulation and raises the risk of pregnancy complications. It even impacts libido by affecting blood flow and nitric oxide production, both essential for healthy sexual function. But perhaps the most serious impact of low folate is on the nervous system. Your nerves rely on folate to produce neurotransmitters like serotonin and dopamine. Without it, you're more prone to depression, anxiety, memory issues, and worsening neuropathy. The kidneys and eyes are also affected. Folate helps regulate homocysteine, a toxic amino acid that damages blood vessels. Without enough folate, homocysteine rises, increasing the risk of kidney damage, high blood pressure, and retinopathy. So, what can you do to fix it? Like always, start with food. Here are the most folate-rich natural foods. Beef liver, 100 grams, about 140% of your daily needs. Cooked spinach, 100 grams, around 65%. Cooked lentils, 100 grams, nearly 90% cooked asparagus, 100 grams, about 35%. One whole avocado, around 25%. These foods also bring other nutrients that work synergistically with folate to reduce inflammation and stabilize blood sugar. If you enjoy gourmet meals, here are some folate-rich dishes that also feel indulgent. French duck liver pâté, 100 grams, nearly 200% of your daily folate. Truffle risotto with asparagus and spinach, 200 grams, around 120% Japanese miso marinated black cod with edamame puree, 180 grams, roughly 100%. But if you struggle to get enough from food, or if you're taking medications that interfere with absorption, you may need a supplement. Here's the important part. Not all folate supplements are the same. Many generic multivitamins use synthetic folic acid, which has to be converted by your liver into the active form your body can actually use. And for people with certain genetic variations or chronic conditions like diabetes, that conversion process is inefficient. What you want is methylfolate, also known as 5-MTHF. This is the bioactive form, ready for your body to use immediately. Top supplement options include Thorne Research, 5-MTHF, 1,000 micrograms per capsule. Pure Encapsulations, methylfolate, 800 micrograms per capsule. As always, talk to your healthcare provider before starting new supplements, especially if you're already taking medications for diabetes or blood pressure. And don't forget, some foods and habits can block folate from doing its job. Avoid excessive alcohol, limit processed grains like white rice and pasta, and reduce sugar intake, all of which increase inflammation and accelerate nutrient loss. By restoring your folate levels, you can improve energy, nerve function, fertility, circulation, and even your emotional well-being. In the final part, we'll bring everything together, helping you understand how to use these 3 essential vitamins to support long-term blood sugar control and prevent serious complications. You've just learned about 3 of the most essential vitamins for people living with diabetes: vitamin D, vitamin B12, and folate, vitamin B9. Each one plays a unique role in your body, but together, they form a powerful foundation for metabolic balance, nerve protection, and long-term healing. Let's take a moment to understand what happens when you bring them all together. First, vitamin D supports insulin sensitivity, helps reduce inflammation, protects blood vessels, and strengthens your immune system. When your vitamin D levels are optimal, your cells respond better to insulin, your nerves are less inflamed, and your kidneys, eyes, and heart are less vulnerable to damage. Next, vitamin B12 keeps your nervous system sharp and responsive. It helps repair damaged nerves, supports red blood cell production, and plays a major role in energy and mental clarity. Without enough B12, you may feel tired, foggy, and physically weak, even if your blood sugar looks okay on paper. And then there's folate, which complements both vitamin D and B12. It helps repair your cells, balance your mood, regulate blood flow, and protect your heart and kidneys by lowering homocysteine levels. It's also deeply involved in the repair and production of DNA, critical for healing and regeneration. Together, these three nutrients improve insulin sensitivity and reduce insulin resistance, support nerve repair and reduce the risk of neuropathy, protect the kidneys and eyes from diabetic damage, reduce homocysteine, lowering cardiovascular risk, improve mood, memory, and mental clarity, boost energy, reduce fatigue, and enhance quality of life. In short, they help your body work better, naturally. So how can you apply this knowledge in your daily routine? Here's a simple 3-step framework. 1. Start with food. Always. Nutrition is the foundation of healing. Try incorporating more of the following into your weekly meals. For vitamin D, wild salmon, sardines, egg yolks, mushrooms exposed to UV light, cod liver oil. For vitamin B12, beef liver, clams, sardines, salmon, eggs. For folate, spinach, lentils, asparagus, avocados, and beef liver. Even if you don't eat gourmet meals, building your diet around these foods can make a major impact. 2. Use supplements wisely. Sometimes food alone isn't enough, especially if you take medications that block nutrient absorption, like metformin or acid reducers. Here's what to look for. Vitamin D3 with K2, at least 1,000 to 5,000 IU daily, depending on your blood levels. Methyl B12, 1,000 to 5,000 micrograms, preferably in sublingual form. Methyl folate, 5-MTHF, 400 to 1,000 micrograms daily. Always buy from trusted brands like Thorne, Jarrow Formulas, or Pure Encapsulations to ensure high quality and proper absorption. And talk to your healthcare provider before starting any new supplements, especially if you're on medications or managing other health conditions. 3. Avoid nutrient blockers. You might be doing everything right, but still not seeing results because something in your routine is interfering. Limit or eliminate refined sugar and white flour, which deplete B vitamins and create inflammation. Excess alcohol, which damages your stomach lining and liver, key organs for nutrient processing. Processed vegetable oils, which increase oxidative stress and impair vitamin D metabolism. Acid-suppressing drugs, like omeprazole or lansoprazole, which block B12 and folate absorption. Healing isn't just about adding the right things, it's about removing what's blocking your progress. And finally, give your body time. You didn't develop diabetes overnight, and healing won't happen overnight either. But by giving your body the tools it needs, nutrients, support, consistency, you allow it to start repairing, adapting, and functioning the way it was meant to. You don't have to be perfect. You just have to be present and intentional. By focusing on these 3 key vitamins, you can reduce your risk of serious complications, improve how you feel daily, and take back a level of control in your diabetes journey that you may not have realized was possible. If this video helped you, please hit the like button and leave a comment below. Let us know which of these nutrients you plan to focus on, or which one surprised you the most. And if you're serious about natural, supportive strategies for living well with diabetes, don't forget to subscribe to Smart Sugar Life. We post weekly tips to help you heal from the inside out, with balance, clarity, and hope. Thank you for being here. Take care and stay healthy.